evening and welcome to yet another show of Healthy Living on Ncdohtv. I'm Malik Gau, the man of the mind as such, your host. And this program is brought to you, rather, by the Northern Cape Department of Health in association with all these medical professionals that works for the department and giving us great information. We are in Upington, and it might look a bit different in the studio. We are at Dr. Herisurti Hospital in Upington in the ZFM district, and we are talking to Sister Anna Padmaker. Sy sê as ons wil apart hê, ons moet net vir haar vra. Sy sê hy plan maak om ons apart te gee. Be part of the conversation by simply liking our Facebook page and following it, and also going to YouTube and liking and following our channels there. And of course, drop your comments, or even ask your questions on our platforms. We have X, we have Facebook, we have Instagram, we have YouTube, Yonke into Corner, just to make sure that you are informed. And this evening, I'm joined by, as I said, Anna Padmaker, a sister who is a operational manager at the Outpatient department, specializing in oncology. Mama, good evening and welcome.
Good evening, Malik.
Me Padmaker.
Good evening, it's nice to meet you.
Yes. What exactly is radiography?
Radiography is it's a technique that we use to take images of a certain part of a body of a patient. Say, for instance, the doctor want to know if the patient has infection in the lungs. Then the doctor send the patient for a chest X-ray to do X-ray for that. En Afrikaans is vir ons Afrikaanse gemeenskap moet sê, dit is ons gewone ekstrale wat ons neem vir die pasiënte, as ons pasiënte byvoorbeeld van 'n sekere gedeelte van jou liggaam wat ons neem, wat as dokter dan bekommerd oor iets is wat ons 'n diagnose wil maak op die pasiënt.
Of miskien het ek
of jy gebreek is, jy dalk gebreek, jou arm gebreek of so, dan kan ons vasstel, is dit nie dalk net 'n swelling nie, of is dit nou regtig gebreek, of so, of is daar enige infeksie of iets wat daar is. Dit word vasgestel deur ekstrale.
Now, what type of health conditions can be detected early through this medical imaging?
Like I said now, it can be pneumonia. When you got a lung infection, doctor asks for a chest X-ray. You can detect pneumonia. You can also detect TB through it. If you can also detect if the patient has enlarged heart also, and if the patient was fallen, there's a patient maybe possibly have a fracture, a bone fracture. You can also detect that on it. And if you want to see if the patient has a brain metastasis, the doctor can also do a brain scan to do that also, to do brain scan to detect if there's brain cancer also.
So there's a whole range of diseases.
There's a whole range of diseases like arthritis, all of the diseases that can be detected through the X-rays.
Wow. Now, tell us about the colon cancer and the screening of colon cancer within the province.
Colon cancer is really a disease. It is one of our top cancers that we have here in the Northern Cape. We have a team from Grooteskier who are assisting us under the leadership of Prof. Goldberg from Grooteskier Hospital. They are visiting us once a year, and they screen all our patients which are diagnosed with colon cancer, as well as the families. They are also coming with a genetic counselor to Upington and and they travel through the whole Northern Cape to see our patients with colon cancer, as well as the families, to screen them for colon cancer. And then through their screening, through that early screening, they can prevent that one of the other families will have that same disease, because they are taking a lot of blood results. There is a genetic counselor there. They are taking a lot of blood results there to see, because it is genetic. It is the Lynch syndrome that they are doing for us, screenings that they are doing for us. And they are sending it abroad, and they can tell us from there, they will tell us, we can send the patient to Cape Town, or we send the patient to RMSH, and the patient, they can do the patient, Dr. Kimi in RMSH, they will do for us the colonoscopy on the patient or all the other tests, and we start the patient on chemotherapy or radiation therapy.
Now, how can families make the most of community health campaigns, specifically for preventative care?
Families, they can visit the nearest, they can go to the nearest clinics, but we also have here is with the security care team. Usually they come also with a pink drive, and we invite the families to do, especially the women, they to do breast examinations. We inform them, we show them how to do the breast examination, what to observe for when they do the breast examination, and then we send them for a mammogram. Usually there is a doctor on the truck. If we find something abnormal, and then the doctor will do the biopsy on the patient. But for the families, we usually encourage them to do the breast examination.
Yeah. And it's also important for our viewers at home to know that breast cancer is not only for women.
For women,
although very rare amongst
rare,
men.
Yes.
So men, get yourself checked.
Yeah, they must do it because we have 2 males.
Yeah. and that other cancer called prostate. You know where?
You know. Yeah.
Now, let's say a patient needs radiation treatment. Where do they go, especially within this part of the Northern Cape in the ZFM district?
Our patients, we are working hand in hand with RMSH. Our patients are going to RMSH for radiation therapy. And what makes it now more easier for us is we discuss all our patients with our head of oncologist at RMSH Hospital, Dr. Usifofi, and then we can start the patient here. If the patient have a longer date to wait for the radiation therapy, we can start the patient on chemotherapy here while the patient are waiting for the chemotherapy, not to delay to prevent and delay the treatment of the patient.
Well, now, how do we then prevent cancer? I know some cancers are genetic.
Yes.
But how do we then minimize the risks of me, Malik, getting cancer?
Malik getting cancer? You look at your risk factors of cancer. Like obesity is one of the risk factors. What you eat, what you drink. You must see what you eat and what you drink. Nowadays, we just go and eat all the fatty stuff. We don't do like our old people were doing in the old days. They were making their own gardens. We have to go back to that and back to our roots and do that again. Then we will have a healthy life. It's not. I can't say to anyone go and live a healthy life because we are living in a poor community. But we must try our best to do what's best, what you think it's best for your community. Because like smoking is also very bad for cancer for your lungs also. We know one of your occupational diseases is also this, when some of the patients were painting, but it's one of the jobs that they are doing. You can't say to them that, so they must wear protective clothing when they are painting. And the dyes that the ladies are using to dye their hair can be also one of the factors that can cause skin cancers. And you must also wear a hat, sunglasses to prevent skin cancer and to protect your eyes also.
Is it waar as jy bietjie donker soos ek, dan het jy minder risk voor cancer, skin cancer? Is het waar of is het net 'n myth?
Daar is nog nie so iets bewys nie, maar scientists het bewys dat die meeste pasiënte wat skin cancer het, is lig gekleur en het blou.
Okay.
Okay. So
daar is bietjie van 'n
daar is bietjie van iets
ding.
Daar is
Baie
As jy by jou gevalle van velkanker kyk, dan is dit nogals die meeste kry jy by die lig van kleur mense.
Okay. And thanks to Anna Padmaker, who is the operational manager at the Outpatient department specializing in oncology. And of course, we're going to take a short break. When we return, we'll be speaking to Samantha Isaacs. Be part of the conversation by simply going to our social media platforms and liking the pages, leaving your comments, and asking your questions. We'll be right back with Samantha Isaacs just after this. Welcome back, and you are watching Ncdohtv, Healthy Living, brought to you by the Northern Cape Department of Health. I'm Malikau, and in studio I'm joined again in conversation by Samantha Isaacs, looking all camouflagey, but hey, you know how it is. These days, scrubs are different, hey? Samantha, good evening, and welcome to the show.
Hi, thanks for having me.
So what do you do at radiology?
I am a radiographer, so I radiograph. No, I'm just kidding. We take X-rays, commonly known. We literally are the eyes of the doctors who ever request the examination. We look at the patient's insides with our equipment, with X-rays, and see whatever is fault or not. Sometimes there's no fault, but that's what we do. We see the body from the inside.
So you see the inside from the outside.
Yeah.
Now we spoke earlier on about imaging and how many types and the different types of imaging are there in radiology?
In radiology, you get first of all you get three different genres. You get the diagnostic part, you get the therapeutic part, and the nuclear medicine part. We concentrate mostly on diagnostic. I'm a diagnostic radiographer. In diagnostic radiography, you can get your general X-rays, which is the normal, like plain X-rays as we call it, that gets asked via through trauma casualties or in the wards or mere outpatients that comes from clinics. You get more specialized viewing. You can get the ultrasounds or sonar that also get requested. It's viewing through sound waves. You can get a CT scan, computer tomography. It's also a form of X-rays, but it is ultra thin slices that get captured and created into a real life image. You can get fluoroscopy. That's also a type of X-rays where we give patients fluids to drink and then follow it through the channels that it's going. And we do X-rays in theater for different specialties. In our case, we normally concentrate on orthopedic operations. Then we aid the doctor in looking at what he's doing.
Now, what is the fundamental role and the importance of radiology that it plays in healthcare services?
For me, I see radiography, we are like an aid to medicine. We help the theme actually for this year's International Radiography Day is see the unseen, and that's exactly what we do. We can, whatever the doctor could think of diagnose could be wrong with the patient, we definitely can highlight that and make sure that it is that, or direct the doctor into the right direction. So we help to see whatever diagnosis the doctors put out there. So we are the eyes of medicine.
Oh wow. Wow.
Agree.
So if the doctor thinks that, okay, there's something wrong with Malik's chest, and we come to you guys, how do you then direct the doctor to something else? To, maybe it's not even his chest, it's
Yes.
something else.
The doctor would request a chest X-ray. Then we will provide a chest X-ray. But also in a chest X-ray, there's a lot of other stuff that will be included. So even if you think it could be your chest, then it could possibly be your heart, or even your tummy. You could have epigastric pain. And from that chest X-ray, it could direct the doctor then not to the lungs, but to a different area that could be part of your problem.
How would you then encourage these young people to get into radiology and radiography?
Radiology or radiography, it's a very inquisitive field for me. If you're curious about what's happening and what's going on, radiography is definitely the way to go, especially in health. They have to have natural science and life science and mathematics. It's a 4-year course.
Pure maths.
Pure maths.
Oh, okay, not the other one.
Yeah, not the other. I'm so old school. I don't even know the other one. At the universities, it's a 4-year course, but it's definitely, if you love working with people, because it's very hands-on. You work directly with patients, and in healthcare, then radiology is definitely a nice route to go.
Now, why is it dangerous for anybody, especially females, when they're pregnant, to be working with X-rays?
In these days, it's not that much dangerous, because there's a lot of precautions that gets taken now in this time and age. The radiation, it's dangerous for unborn babies. The extent of the danger, it's not totally set out. So that's why a lot of precautions get set when you are pregnant. But we work while being pregnant, and we aid in patients that's pregnant as well. They get X-rays. We protect them with our lead protectors. There is a lot of safety now in radiology with radiation for the patient as well as the radiographer.
And how does this play into, we're pregnant and then we do a sonar? Is it the same effect, or?
Yes and no. Not all pregnant patients will get a sonar just because they're pregnant and they need X-rays. That's where the gynae department comes in. The need for the X-ray needs to be established. What is more important, the X-ray needs to happen, or the baby that needs to protect it? And that's where the gynae comes in, and they will assess the safety regarding the pregnant patient.
Wow. So I thought maybe there's a bit of a danger, especially because you spoke about sound waves earlier on. And a lot of parents in the modern 21st century, mom and dad, they go and they want to listen to the baby's heart.
Yes.
How dangerous is that?
That's safe. Sound waves is safe. It's not radiation.
Okay.
It's sound. It's imaging through sound waves.
All right.
Yes.
Your last words to our communities.
I would say, please be gentle with your healthcare workers. They're going through a lot, but also, don't be afraid to find out what's wrong. Go check yourself out, especially now that we are in breast cancer month. It's better to know prevention it's always better than cure. So go find out how to get your mammograms done, how to get your checkups done. Let the eyes guide you.
All right. And men out there, be part of this.
Yes.
We're talking breast cancer for men. And also, let's get ourselves checked out. These are health professionals that are out there to be assisting us so that we live a longer, healthy life. Thank you so much for joining us.
Thanks for having me.
Yes. Let's live a healthy life out there. Let's start exercising, cut out or reduce on your alcohol, reduce on your smoking with the aim to stop. And let's eat healthy. Plant your veggies in your yard. It's not that expensive. I'm sure there are shops around that would be selling seeds for vegetables, and plant them and grow them. And you'll actually find out that they taste better than the ones that you might buy somewhere. and it's cheaper. So it does not mean if you're not earning much, you can't eat healthy. Eating healthy is actually cheaper than eating all this junk food that we're eating. Let's take care of ourselves and let's be physical. Let's run, let's walk, let's exercise and live healthy so that we have a healthy, better nation in the future, particularly our young people. Enjoy your youth in a responsible way. This has been a live broadcast brought to you by the Northern Cape Department of Health. It's Healthy Living, coming to you live on your social media platforms every Wednesday at 7 p.m. Don't miss it. I'm Malikau. It's time for me to go. Thank you so much for joining us. Bye-bye.